Hello friends, my name is Dr. Purudhavan and in this video we will talk about diet, which will help every kidney patient to control creatinine, urea, potassium, sodium. So let's get started. Diet plays most important part in any kidney treatment. 50% of treatment is just depend upon diet. To understand what kind of diet should a kidney patient take so that patient can have a non-complicated life is very important. We can control each and every component of kidney health just by diet. Now I will give you tips that will help you to control creatinine. If we want to control creatinine, we can do it by two ways. First, we can increase the kidney output so that the creatinine can be excreted out as urine, or we can decrease creatinine production by reducing protein intake. Only few of us knows that creatinine is a waste product of muscle metabolism. Anything which increases muscle metabolism also increases creatinine in blood, like fever, exercise, weightlifting and protein intake. So if a kidney patient wants to decrease creatinine, one should avoid protein completely. All kind of exercise should be avoided and make sure that body temperature remain normal. It has been seen that if a kidney patient reduces protein intake, level of creatinine decreases rapidly and also progression of kidney failure slowed. Why? Because to digest protein, body is unable to excrete excess amount of acid. This accumulation of acid causes change of pH of body. Body become more acidic. This condition is also known as acidosis, as this acid damage kidney further. So all kidney patients of Science and Jeevani are advised not to take any protein. Whenever I say to this my patient, most of the time the next questions are always what we can eat, what vegetables I can eat, what foods are good for me. Lots of questions. Now I will answer all of them one by one. Let's start with vegetables and fruit. If we take care of vegetables and fruit in diet, potassium can be managed easily. Potassium gives power to muscles when it is in the right amount in the body. But when kidney stops working well, level of potassium increases. This increased level of potassium affects badly on all muscles. It produces fatigue. As our heart is also made up of muscles, increased level of potassium damages heart muscles. Level above 7 in blood may cause heart attack. So to keep potassium in check, it is must for every kidney patient to control potassium. We advise all kidney patients to consume low potassium fruit and vegetables. Now I will tell you about low potassium vegetables. Keep simple rule in mind. Always avoid rooty and leafy vegetables. Rooty vegetables like potato, sweet potato, turnip, taro root, any vegetable which is grown below the surface of earth is not advised to a kidney patient. Only exceptions are onion, radish and carrot. Now any vegetable which grows as fruit on a plant or creeper like tomatoes, peas, brinjal, okra, bottle ground, snake ground, pumpkin, all are allowed. But even these low potassium vegetable contains potassium. It's low in comparison to others, but it's there. To further lower the potassium, we can leach vegetables. It's simple process. Just fine chop all the low potassium vegetables you wanna eat, soak them in lukewarm water for next 3 to 4 hours. When we soak vegetables in lukewarm water, all potassium present in the vegetables comes out in water. Level of potassium further drops in those vegetables and they become more favorable for a kidney patient. Now let's move to fruits. In fruits, avoid all high potassium fruits, and they are banana, kiwi, dates, avocado, all dry foods. Rest all fruits are allowed, but in a fixed proportion. You can take an apple, grape, pineapple, oranges, watermelon, muskmelon, any one you want, but your quantity for a day is a cup. That means whatever fruit you take, its quantity should not cross a cup. You can take 1 apple, 1 orange, 1 cup of pineapple, 1 cup of watermelon, or 1 cup of mixed food you want, but the quantity can't exceed 1 cup. Portion help us to control potassium. Now let's move to breads. A kidney patient take as much as bread, chapati and rice. Just avoid rice if you are diabetic. White bread is considered more healthy than brown bread or multigrain bread, as it contains lesser amount of potassium in it. Now let's move to sodium. Sodium is needed to be controlled because if sodium increases, it causes hypertension and accumulation of fluid in lower limbs. So if you are facing swelling or edema in body, simply avoid sodium, and our main source of sodium is salt. If a kidney patient avoid all kind of salt, not only level of blood pressure comes down, swelling in the lower part of the body also disappear. If your kidney patient ignores sodium, sodium can also be fatal, as sodium increases blood pressure and fluid accumulation, which can be dangerous for a kidney patient's heart. So we have controlled creatinine, potassium and sodium just by diet, which is one of the major concern for all kidney patients and as well as for doctors. This will help all kidney patients to slow down progression of kidney failure. Now imagine, what if your own filtration process, your own dialysis machine means your own kidney starts filtering better and your kidney failure condition can be reversed. Wait, that means you may not need any kind of dialysis or transplant, no need for AV fistula? Yes, this can be done only when we start working our own kidneys. Your kidneys are getting damaged because of high level of diabetes and hypertension. We at Science Engineering works on the root cause of kidney failure and reverse the damage to the kidney. We call this treatment as kidney function restoration treatment, KFRT in short. In KFRT, our first objective is always to identify the main culprit for kidney failure. In most cases, it's diabetes or hypertension. In some cases, we find allopathic drugs like painkillers or any kind of antibiotic as the cause of kidney failure. Once the cause has been identified, we know the kind of damage that has been done. Then kidney function restoration treatment moves accordingly. This treatment not only controls the cause of kidney failure, it also helps kidney to improve kidney function. And kidney functions are excretion of waste and excess material from the body like creatinine, urea, sodium, potassium. As the body starts excreting them, level of creatinine and urea comes down, which is easily be recognized as a better urine output, better appetite, change in your creatinine levels, urea levels, and these changes can be seen within a month once the level are in control. Now kidney has no pressure to filter them out, all causes of kidney failure are in check, then kidney starts its healing, and within few months natural function of kidney is restored up to great extent. Need of dialysis ends and your own dialysis machine start working. All communication of dialysis, surgery, transplants goes away as you don't need them now. And this is the main objective of Science Engineering, to provide you a non-complicated life with best renal care. I hope this video will help all kidney patients to understand how a right diet can help them to control creatinine level, how we can slow the progression of disease, how with the help of KFRT we can regain kidney function back. If you still have any question, you may ask our doctors on the number given below. They will guide you all about the kidney failure and kidney function restoration treatment. You may visit our website scienckidneycare.com, where a small form is given. Just you have to provide us information like your name, age, gender, problem you are facing, current level of creatinine, undergoing dialysis or not, how many times you have to go for dialysis. You may attach your medical reports like kidney function tests, biopsy report, ultrasound. Once our doctor examine that, they will contact you. If you still have any question, leave a comment in the comment section below. Now it's time to say goodbye. Goodbye. See you soon in our next video. Don't forget to like and subscribe.